This year's flu season is obviously the worst flu season we've had in the last few years. Clearly, it's started earlier and it's picked up speed much quicker than flu seasons we've had. The way you can tell the difference generally between the flu and a cold or other viruses is that flu generally comes on very quickly, and people often can tell you the exact moment they started to get sick, with shaking, chills, and headaches and fevers. It tends to be a much more dramatic and much more acute onset disease than a cold. Otherwise, many of the symptoms are very similar: runny nose, sore throat, headaches, mild aches, fevers. You don't generally have gastrointestinal symptoms with typical influenza like you do with norovirus or some other gastrointestinal viruses that we may see at this time of year as well. The treatment is basically the same treatment as you get for the common cold, which is rest, plenty of fluids, Tylenol or other medications to help reduce your symptoms, and you wait it out. So if you're healthy, that's generally the recommendation for treatment. For patients who have underlying diseases or are severely ill, who seek out help from their physician, those people get treated with antiviral medications generally or other supportive care. And it's generally with patients who have underlying diseases. They're at greater risk of complications from the flu. And if they're feeling sicker than they would feel with a typical cold, they should probably see their physician. For patients who have very high fevers and are feeling confused, for patients who are having shortness of breath, or for patients who get better after several days and then get worse again, those are all people who should see their physician. So ways to prevent yourself from getting sick or getting the flu are to do all the things that we generally tell people to stay healthy: get plenty of sleep and eat right. But to avoid actually getting exposed to the flu, wash your hands a lot, avoid touching your eyes, your nose, your mouth, cover your cough if you are sick and you can prevent spreading it to other people. And potentially when there are large outbreaks of disease, stay away from areas where people congregate, movie theaters and other areas where you may be exposed to people who are sick as well. So for patients who haven't gotten the flu vaccine yet, it is definitely not too late to get the vaccine. And while it may not be 100% effective, even in those patients who get the flu after getting the flu vaccine, they tend to have a milder illness than patients who haven't gotten the flu vaccine. It takes a couple weeks to develop full immunity after getting the vaccine, but this flu season may last for many more months.